Today we're going to talk about eyelids, and I want to give you a different perspective on what traditional procedures we have toward the eyelids. A lot of times when we look at the lower eyelid, by the way, we'll explain what this is for in just in a moment if you're wondering why I'm carrying a balloon. The lower eyelids, we oftentimes look at it as an eye bag. In fact, that's how we traditionally look at the lower eyelid. We say, hey, that person's got an eye bag, or I've got an eye bag, can you fix the bag? But it's actually the inverse way of looking at the lower eyelid. I want to explain to you a model so that you can perhaps understand this a little bit better. The best way to understand the lower eyelid is not an eye bag, but a shoreline. So picture the lower eyelid contour like a shoreline in youth. It's filled up to the rim so that you don't see anything, and you don't see any bags or anything. As we get older, what happens, the shoreline begins to recede and disappear, and what shows up? The rocks. Now, these are not the rocks yet. This is for something else. But you actually start showing up the rocks in the lower eyelid. Those rocks are the bags. The way that I fix this is, instead of taking the bags out in most cases, I refill the bottom area up so the shoreline is at high tide. You don't see the rocks anymore. Now, in about 1 out of 10 people, the rocks are so prominent that I know that to get the best result, I have to take some of the rocks out and also fill the shoreline high. So let's just make this a little clearer. Let's say when you look at the lower eyelid, you'll see the bag, okay, quote unquote the bag, what I call the rocks, and you'll see below it the shoreline receded away so you can see the bone around it. So the trick here is not to put more fat into the rocks or into the bag, but just around the perimeter or rim of this area so that the contour is smoother, so the shoreline is back up. Now, why is that so much better? Well, one is because that's actually what you had in youth, and so that's actually simulating what you had. If you go to my blog section and you look at the photo of Sharon Stone, I think it's one of the most convincing photographs, which is matched out for position. Her brows are in the same position, her eyelid is the same position, her lower eyelid is the same position. Every part of it is the same position, but she's just hollower. So you'll see that oftentimes when you're in your 30s and 40s and even beyond, the principal mechanism of aging is volume loss around the eyes. And that's for the eyes. And we're talking about the neck. We don't want to put volume there. That's a lifting procedure. But I've now been able to really look at the upper face as principally a volumetric loss. That is a loss of soft tissue, loss of bone, loss of fat that needs to be plumped up and brought back. And the only way for you to understand this more convincingly is for you to take a step back and actually look at yourself in youth and match out those old photographs. When you see it, there is no equivocation that actually what you're seeing is volume loss and loss of tissue. And if you don't understand that, come back here, sit down with me in consultation. Let's look at those old photographs. So this is an extremely different approach than most plastic surgeons. So again, the lower eyelid you should think about like a shoreline. Now let's talk about the upper eyelid. The thing that's so troubling to me is that the upper eyelid oftentimes is lifted or taken away. So what we call a blepharoplasty, or a plasty meaning changing the shape, is really a blepharectomy. It's excising and taking away. And you look at particularly older men or even women, they just look hollowed out and pulled out. So what I'm doing is putting the frame back in. So this is extremely counterintuitive as well, because initially I say, you've got an eye bag, I don't want to take the bag out, I want to fill it in with more fat. Well, how the heck is that possible? It doesn't make sense to me. Well, when you sit down with me and look at those photos, it becomes crystal clear to you. That's why you need a consult with me. I'm going to give you a simplified model for the upper eyelid. So we just talked about a shoreline for the lower eyelid. Let's talk about the upper eyelid. The upper eyelid is like a balloon. When you are in youth, there is fullness to the brow. And if you go look at that Sharon Stone photo in my blog, it'll become very, very clear, because her upper eyelid brow is exactly the same brow position, or eyelid skin is exactly the same position, but you can see the rim of bone around the eye. So what I want you to do when you go and look in the mirror, if you're past your mid-30s into your 40s and 50s and beyond, I want you to see if you can see your bone exposure. Now, some people that have a youthful brow have more of a prominent brow position, and that's a good thing, okay? Linda, who's filming my video for me, has a great brow position. So that brow strength is what makes the upper eyelid look more youthful. So what happens when we get older? Is it the fact that our brows come down? Actually, no. Now, how do I convince you of that? Is it just great before and afters? No, it's fundamentally predicated upon your old photos. Go back and match your photos. You will see your brow actually did not come down. That's why this is a mistake. It was full in youth. And as we get older, so does that look like it's hanging? Of course it looks like it's hanging, because it's deflated. So instead of cutting everything away, you need to fill it back up. So if you look at the Sharon Stone photo, if you go back and look at my before and afters, you'll begin to have a vocabulary of understanding what is going on with one's eyes, because it's so puzzling. And if it doesn't make entire sense to you, you really need to sit down with me in consultation. So think of those two elements. The upper eyelid is like a balloon that deflates, and the lower eyelid is like a shoreline that recedes. And if you think of it from that context, I think you're going to get a better understanding truly of how the eyes age, and that will be the most fundamental area to rejuvenate, to make you look more rested and youthful. Thank you.